Okay, if you've made it this far, chances are you know what BAT levels are. You get the biology, you've seen the other videos, you understand why we track beta-amyloid and tau, and what it means when those biomarkers start to drift. So let's shift gears. This isn't going to be another explainer about the science. This is about how the process actually works once BATWatch is integrated into your practice or once we become a part of your workflow. How we keep it simple, how we keep it compliant, and how it fits in the primary care without adding any burden to your day. Let's start with the first thing. How does this even come up with the patient? It's really as easy as letting them know we can now test for brain health with simple labs. It's just as easy as A1C or cholesterol. You can just easily add this to your lab order. That's the moment that matters because BAT levels don't require a diagnosis. They don't require symptoms. It's a preventative signal in the brain. It's a check engine light, something that we now have the power to track. So if your patient says yes, then great. We have two easy options. You can either order the labs yourself through Quest or Labcorp or any other network that has beta-amyloid and tau testing. And at the time of this video, there's about 8 validated options that are available for beta-amyloid and tau testing. So you're not locked into one vendor or another. Some are covered by insurance, some are not. Or if you want to keep things simple, you could just refer them to BATWatch and we'll take it from there. We can easily coordinate everything on our end, scheduling, insurance, patient education, and follow through. And of course, we'll keep you in the loop. We'll make sure you're copied on every single result. Now, really quick, just to address something we hear from providers a lot. Sometimes there's a hesitation, and it usually is not about the lab order itself. It's about what comes next. There's a concern that BAT levels might imply a responsibility to treat or open the door to managing neurological care or cognitive risk or other unfamiliar interventions. And let's be clear, that's not what we're asking you to do. This is no different than ordering cholesterol tests. You don't skip the LDL panel just because your patient may or may not take some statins. You order the lab because knowing is better than guessing. BAT testing works the same way. You're not actually diagnosing Alzheimer's. You're not committing to any treatment plan. You're simply giving your patient the ability to see if their biology is actually starting to drift early enough so they can do something about it. Like I said, we take care of everything downstream, education, confirmation testing, even treatment coordination if the patient chooses to do so. You stay the primary doctor. We're just giving you another option to deliver preventative care without the extra burden. So here's what happens next. Once the patient enters our workflow, we always begin with a simple beta-amyloid test. No spinal tap, no scan, and they could do this at any of the thousands of partnered lab locations we have worldwide. Whether it's Quest, whether it's Labcorp, there are plenty. And if the test comes back normal, perfect. We'll send you the results, recommend that they stay on annual monitoring, and that's it. Super simple. If it's borderline or elevated, we reflex to a confirmation test, either a second beta-amyloid test or we add tau, depending on what we see. Why? Because beta-amyloid can actually fluctuate. Everything from sleep disruption to inflammation, even how the labs handle the specimens can shift the results. And we don't want to react to the noise. So we double check and sometimes triple check before moving forward. That way, if the patient is truly drifting, we know it's real. And if it's just a blip, we don't waste anybody's time or money. And here's something important that I want to make a point about, especially for those providers who are still thinking that spinal taps might be the better approach here. Spinal taps are just not practical for preventative screening. Beta-amyloids fluctuate, and they also fluctuate in the CSF just like they do in plasma, which means to get accurate longitudinal data points, you actually have to do multiple spinal taps, 2, maybe 3, just to establish a reliable trend. No patient is doing that. Who the hell wants to get 3 spinal taps when you can actually just get a simple blood test? That's why blood-based BAT testing is not only easier, it's smarter. It allows for routine monitoring. It enables repeat confirmation without pushback, and it builds longitudinal data sets so that we can actually guide prevention without putting the patient through something invasive just to get a number. If biological drift is confirmed or tau is present, we can go one layer deeper. We then run what we call a contributing factors panel. This actually helps us see what's causing the drift in the first place, whether it's inflammation, whether it's mitochondrial stress, lymphatic slowdown, or something else. We don't make decisions off of a one-off number. We look at how the biology converges because that's where the real insight is. And that's what leads us to the BAT score. The BAT score is at the heart of our system. It's a single clean number from 0 to 100 that reflects the biological accumulation threshold of the patient. How much is building up, how fast it's drifting, and which systems are involved. It's just like the A1C or LDL for the brain. You don't need to interpret any complex panels or sort through any biomarker ratios. We'll send you a clear summary where your patient stands, what direction they're headed in, what next step is clinically appropriate, if any, and all of it can plug right into your existing workflow. Nothing about this process takes any control away from you. You stay the primary doctor. We're not trying to take over patient care. We're here to support it. So now if the BAT score is dropping and the underlying data supports it, sometimes it makes sense to intervene. But again, we're not asking you to do anything. We're just presenting options. And if there is an intervention that's discussed, we don't necessarily call it a treatment plan in the traditional sense. If BAT levels are elevated and the score justifies an action, we usually recommend a short BAT pill cycle. It typically lasts 4 weeks or or 8 weeks, depending on the biology. That's it. No chronic meds, no ongoing commitment, just a brief cycle to help bring those levels back down. Once the cycle is complete, we retest to confirm everything is moving in the right direction. We just drop the patient right back down into the queue for annual monitoring. And so far, the data shows that most patients only need one cycle, especially when we're able to simultaneously address the underlying contributing factors that cause the accumulation in the first place. No maintenance drugs, no burden, just one clean cycle, then back in prevention mode. It's simple, it's targeted, it's designed to correct the biological drift early. It's a generic medication, it's often covered by insurance, and once we prescribe it, should the patient go this direction, we stay hands-on the entire way. Once we see those levels drop with mechanism stabilizing with post-cycle testing, as mentioned, we return the patient back in the monitoring queue. Back to you. Back to routine care. Now, here's the most important thing I want to emphasize. Some patients want us to manage the whole process, and that's fine. And others would rather keep everything in-house with their own primary care doctor, and we're cool with that as well. So if you prefer to handle testing and interpretation yourself, we're happy to guide you through our protocols to ensure your success. We'll walk you through the workflow, provide the education, and help you apply it inside your own system, based on the same evidence and structure that we use. Because to us, it's not about control, and it's not about money. It's about consistency and impact. We're not big pharma, and we don't make tests, and we don't sell the medication. Our job is coordination, making it easier for you to deliver smart preventative care. We are here for one reason, and that's to make brain health as easy and actionable and preventive as every other system in the body. If your goal is to get ahead of cognitive risk before brain health is affected, BATWatch is how we do it. Track drift, score the biology, intervene early if needed, then monitor year after year, just like everything else in preventative care. That's how we win. That's BATWatch.